Hello everyone. Today my topic of discussion is essentials of global health and its importance. It is one of those topics which holds prime importance in today's world. Whenever I talk about health or global health, the first thing that comes to my mind are the words once said by Sri Mahatma Gandhi, that it is health that is the real wealth and not pieces of gold and silver. Therefore, without any hesitation, we can agree with the fact that health is wealth. So global health, as I mentioned, is a focused approach on improving health and achieving health equity for all the people worldwide, which means working towards the absence of avoidable, unfair or curative differences among various groups of people. And this concept holds a lot of importance in today's world so that we can tackle healthcare problems and globally achieve equity in healthcare for the population of the world. But when we talk about achieving health equity, we need to understand the disease burden in today's world first and then try to concentrate on factors which will help to eradicate or reduce them. While countries have managed to decrease deaths from infectious diseases like malaria, tuberculosis, smallpox, etc., non-communicable diseases such as heart disease, stroke, mental illness and injuries are continuously on the rise. Furthermore, dual burden of disease, that is countries dealing with both communicable and non-communicable diseases, are also on the rise, especially in the developing nations. As per the reports of World Health Organization's Global Health Estimates, the top 10 causes of death in 2019 were ischemic heart disease, stroke, chronic obstructive pulmonary disease, lower respiratory infections, neonatal conditions, trachea, bronchus and lung cancers, Alzheimer's diseases, diarrheal diseases, diabetes mellitus and kidney diseases. And these diseases are continuously on the rise for the last couple of years. Now, talking about our country, India. We as a nation are fighting a dual battle, I would say. If you see the graph present here, you will find that as per World Health Organization, heart diseases, stroke and other non-communicable diseases are the major causes of death in the country. And communicable diseases like tuberculosis and other infections are also not far behind in affecting the population. Also, the COVID-19 was no less than a storm for the country's population and economy. Therefore, from the graphs and pictures, it is quite evident that the burden of diseases are globally on the rise. Also, there are other challenges which also needs to be addressed. The World Health Organization has identified a number of global challenges, and let us now understand them in details. Poverty. Poverty is one of the most serious causes of disease, with 70% of deaths in developing countries are being caused as a result of 5 diseases that can be easily and cheaply combated. The 5 causes are pneumonia, diarrhea, malaria, measles and malnutrition. These diseases could have been easily prevented if there was no inequality in the income of the nations or if there was no poor nations. Also to add, 1/5 of the global deaths are often as a result of malnutrition in the developing countries. Smoking-related lung cancer is also a leading cause of cancer-related disease. Heart diseases, cardiovascular diseases are the leading causes of deaths in the whole world. In Africa, the main cause of death among the adults is the HIV/AIDS virus. HIV/AIDS is responsible for 40% of female deaths in Africa. The global burden of mental illness is also increasing, with depression resulting in many instances of disability. Road traffic accidents are also increasing across the globe as an increased number of cars and also because of urbanization. Also with respect to India, if we see, as per the reports of Ministry of Health and Family Welfare, there is a shortage of water and electricity in the hospitals of India. Many health facilities are functioning without water and without electricity supply. In Bihar, 31% of the primary healthcare centers have neither water nor electricity supply. 20% of the primary healthcare centers in Uttarakhand and 16% in Kerala have no regular water supply. Apart from that, one of the major issues of the healthcare industry which is facing today's world is in the low-income countries especially is manpower. As per the reports, there are 57 countries with a critical shortage of healthcare workers and also a deficit of 2.4 million doctors and nurses have been found in various parts of the world. With respect to India, if we see, the condition is quite similar. There is a shortage of doctors, nurses, administrators and other non-clinical staffs. As per the data released by Ministry of Health and Family Welfare, the shortage can be felt especially in the rural regions. States like Bihar, Madhya Pradesh, Chhattisgarh and many more do not have specialist doctors in the rural hospitals. Also, states like UP, Bihar, Punjab, Jharkhand and many more also have shortage of nursing staffs and other staffs. This is definitely a matter of concern. Again, as these diseases are rapidly rising and therefore to handle such crisis, we need to focus on the healthcare delivery models or the healthcare delivery systems, infrastructure, available technologies and most importantly manpower. Generally, by the term healthcare delivery model, we mean a system of people, institutions and resources through which healthcare facilities are given. Therefore, these systems plays a major role in reducing disease burden across the world and especially in the poor and developing countries. But as per the recent assessment, it was seen that there are inequalities in the healthcare delivery models and thus the concept of global health cannot be achieved without making comprehensive and affordable healthcare systems available to every person in the world. It is one of those areas where focus needs to be given. Also, with respect to the infrastructure, the government needs to focus on the existing healthcare facilities and also establish new ones which will serve the nations. This is mostly required in the developing nations. Introduction to the new healthcare technologies and innovations is the future of healthcare industry. Also, to achieve global health, focus needs to be given not only to the above mentioned topics but also on the certain things like education, housing, poverty, governance, human rights, sanitation, water access and most importantly the environment. In this context, I would like to mention that healthcare sector is one of the most rapidly growing sectors and especially after the pandemic it has gained a lot more importance. The global healthcare market size was valued at more than 5,000 million US dollars in 2017 and is projected to reach more than 8,000 million US dollars by 2025, exhibiting a CAGR of 4.1% in the forecast period of 2018 to 2025. It is an extremely profitable and demanding sector. Therefore, the sector definitely needs a lot more professionals, hospital administrators, doctors, nurses, paramedical staffs and other non-clinical people. This not only will help in reducing the disease burden but will also help in achieving the goals of global health for a better living and for a better world. Thank you.